Hi everybody, I'm Brady from Freedom Physical Therapy, and today we've got Jeff back to help us answer some questions about TMJ and TMD. Now 2 weeks ago, Jeff did a live video that went pretty in depth about some of the treatment topics that he goes over with people and dentists and doctors, and he did a very thorough talk to you guys about TMJ and TMD and some of the things that he's looking at while he's seeing patients. And I guess I had some follow-up questions that I thought, just as a layperson or someone who was part of the general population and not a treating therapist, that I would have if I came in for TMJ or TMD problems. So what I did is I came up with a list of questions that we get from patients, and that just I had and I was curious about. So I'm going to get started, and I'm going to ask Jeff these questions, and he's going to kind of help explain what he's seeing then as the treating therapist. So first of all, Jeff, we just want to go over what is TMJ, what does that stand for, and what is that?
Well, we have joints all over our body, and TMJ is just an acronym for temporal mandibular joint. The joint actually can be found on the human body by this little spot right here. It's called the tragus of the ear, and by putting pressure on that spot and opening the mouth, a person can actually feel the joint move. You can either stick your finger in your ear or right on the tragus, and if you open and close your mouth real gently here, you can actually feel movement. So it just simply stands for temporal mandibular joint.
Okay, and so a lot of the times TMJ and TMD are kind of thrown around a lot. We get, we say we're treating the TMJ, or I have TMJ problems. So what is the difference between TMJ and TMD?
Great question, and it's just really semantics. TMJ, we all have temporomandibular joints. We don't all have temporomandibular disorders or dysfunction. So when you hear somebody say, I have TMJ, really what the layperson is pretty much saying they have a temporomandibular disorder. They're just misusing the acronyms. Sometimes you'll hear dysfunction, but disorder, dysfunction are synonymous. We all have TMJs or temporomandibular joints. We all don't have temporomandibular dysfunction or disorders.
So I guess TMJ and TMD, they're not, unless you've been told you have something like that, it's not necessarily something that you might seek treatment for. So I guess one of my first questions is, what's going to lead me to seek your help? What is the process of an average person who doesn't know about TMJ or TMD? How do they find you?
That's a great question. I alluded to this at our last video, how unfortunately there are a lot of people that go undiagnosed for, upwards of 4 years, I think is what the studies say. One of the reasons I get out and try to talk to the dentist on this topic is you see your dentist twice a year, and ultimately if you have challenges with symptoms consistent with a TMD issue, hopefully the dentist can start to steer you to a TMJ therapist or a therapist that has special training and background in order to treat this population. We're also reaching out a little bit to the ENTs, because a lot of times patients will have problems with their ear that they think is an ear problem, and in fact it's a TMD problem. The other population that we're getting referrals from are audiologists. I did a talk on the topic of dry needling to a group of audiologists at a local hospital here, and they have been referring patients for somatic tinnitus, which is just a fancy word for ear ringing related to muscles, and typically muscles of mastication. Our therapists here also do a full screen, so if you come in with a headache or any sort of neck or facial pain, you will be screened for temporomandibular disorders. So comprehensively, that's how we try to get people to be able to get help from somebody like myself or somebody with advanced training in temporomandibular dysfunction or disorder.
So you had mentioned the ENTs and the audiologists looking at those kind of specific reasons why they would come in. What about your dentist? Like, what are some general things that you'll get from a dentist, or that a dentist will notice that they're like, oh, I need to have them see Jeff?
Great question. Yeah, it could be multiple things, multitude of things. Could be that they're actually having facial pain unrelated to the teeth. I just had a case recently. I alluded to it actually a couple weeks ago when I was on. The person had very specific tooth pain that the dentist was essentially saying there was nothing wrong. We did some dry needling to this muscle on the side here, and she came back, she said, my tooth pain is gone. So the dentist, if a patient has tooth pain and they feel that the teeth are fine, that would be one reason that they would want to potentially refer to a patient or to a PT like myself. Patients may also have some pain with eating and chewing, and sometimes dentists will ask those questions and then refer on. Clicking and popping that's painful is another reason why they might refer to somebody like me or a patient that has headaches, recent headaches. Typically, though, if we get a patient that has clicking or popping or noise that's been there for a long time and they're pain-free and functional, we'll send them away with some instructions on how to manage that. But as long as they're pain-free and functional, we typically don't treat that population. It's typically they have to have some sort of a painful endeavor with ear pain or jaw pain, headaches, tooth pain, that sort of thing.
Okay. So as I've seen patients, working here get into treatment with you guys, and as I've heard you guys talk about treating TMJ and treating TMD, you always talk about joint versus muscle issues. So how do you distinguish, or how might you treat differently someone who has an actual joint problem, or if it's muscular in nature?
Great question. In fact, we take it one step further. Is it joint, is it muscle, or is it potentially disc? But to answer your question specifically, normally in our palpation, when you open the mouth a little bit and you get inside the ear over that tragus we talked about, that's going to be quite painful. And so just our palpation exam into the joint, and we do a bite test. I think I alluded to it a couple weeks ago, where we put a piece of felt in the back of the molars, and when you bite down, I specifically ask if you have pain. I don't say where, because I don't want to tell the patient what to tell me, but if they have pain on the same side that they bite down on, that would be indicative of a muscle problem, because when they bite down, the joint is actually decompressed. If they actually have pain on the opposite side where they bite down, that would be indicative of a joint, because it actually causes it to compress.
Okay.
So that's how we kind of tease out the difference between muscle and joint, and in many cases they can have both.
Okay. So some things that I kind of thought about in terms of like just normal everyday living, if I was watching this video, what would I want to know? So if I open, you had alluded to clicking with the dentist, if I just am opening and closing my mouth and I have clicking, should I be worried about that, and should I see a TMJ or TMD therapist because of clicking?
Typically not. I mean, most people who have popping and clicking have probably had it most of their lives and are functional and without pain. I would say that if it's something that's new, that suddenly starts up and hasn't been there before, even though you might be pain-free, that might be something that we might want to look at, just to give you advice and education to hopefully keep you out of trouble. But usually it ends up happening the opposite way, where you end up having clicking and popping most of your life, and then one day, oh my gosh, the popping and clicking stops, and now you can't open your mouth very far.
Okay.
And that would be indicative of a disc derangement, probably diagnosed as disc derangement without reduction, meaning that the disc isn't reducing back and clicking, and with limited opening. And if it's on the one side, when we take our range of motion measurements of the jaw, it usually will pull to the side of the displaced disc. So you'll see a person open and the jaw will pull to the one side, or you'll see them protrude and it'll pull to the one side. And when you look at deviation one way or the other, it will be harder to go the opposite direction because the disc is in the way.
So I was actually going to just ask you a question about deviation and deflection. So if I open my mouth all the way and I notice weird mechanics, is that indicative of me having TMD?
It can be, and when we do our range of motion exam, it helps us to tease out whether it's a deflection problem or a deviation problem. Typically, a deflection problem can be where, first of all, it can be a disc displacement, but in many cases it can just be tight muscle pulling that direction. So when you go to open, the jaw actually deflects. It's important that a therapist and dentists and doctors that are working with this population, that we all have the same terminology. So that's why it's important to understand the difference. And deviation is the jaw will deflect to one side and then deviate back to the midline at the end. And then upon closing, we'll pull to that side and then pull back to the midline. So that's deviation. And that very often is more related to disc displacements.
Okay.
And deflection can be a disc derangement, but often it can be muscle. But two different terms for different ways that we treat, and when we communicate with dentists and doctors and other therapists, we want to use a common language that we all understand.
Okay. So can painful chewing be associated with TMD? And if so, how, I guess?
Yeah, absolutely it can be. If the joint gets inflamed as you chew, that space gets smaller and compresses the joint, and if those tissues are irritated, certainly chewing can be a problem. I think I might have alluded to this, but I'll kind of remind people that I had a patient that whose father was a physical therapist, and by the time he came in to see me, he was 80% better. And I said, "Oh, what kind of advice did your son give you?" And he said, "Dad, chew on the side of the pain." It's odd because you have your pain. Most people want to stay away from it, but when you're actually chewing, or at least chewing equally, you're actually creating a displacement of a separation of the joint, and it's not as painful. And when he did that, probably within a week, 80% of his pain was gone. If you just chew on the one side and you create that separation on one side, it's like the bite test, and you're jamming down on the other and just flaring up the joint. So that's a piece of advice that we give people too. Just in general, chew your food on both sides. Nobody leaves here really without a handout on TMJ or TMD self instruction and correction, and that's one of the things that among probably about 15 different items that we suggest that patients try to avoid.
Okay. So you had kind of talked to me a little earlier about having maybe different anatomy than others in terms of having maybe a narrower jaw or a larger tongue. How are those going to affect my jaw? And when you see that in a patient, how are you going about treatment differently, or do you go about treatment differently at all?
I don't think I go about treatment differently, but if I get somebody with a smaller jaw, typically it's retruded back a little bit.
Okay.
And so the actual opening process won't be as far. And those are usually patients that I like to get to the TMJ dental specialist. Some of the specialists that are out there do actually palate expanding, and then can do some great things with splinting and braces to help to change the person's actual bony structure. So that's the smaller retruded jaw. And then the thick tongue is an important thing that we screen for. It's just called a Malin-Potty screen, named after an anesthesiologist who basically created 4 classifications. I will usually pick up on that also when I ask the patient, or if they're tired a lot, or how well they sleep, and they say, yeah, I sleep terrible and I'm always really tired. And what we look at is when a patient opens their mouth, we should be able to see back into the throat and the little thing hanging down called the uvula. We should be able to see that with great detail. But somebody who has, they open and they say, ah, and their tongue is still in the way of that, they're probably somebody that probably potentially has sleep apnea. And again, a referral to those sorts of specialists to take a look at what can be done. Obviously, there's devices that can be worn to help with sleep apnea, and there's a dentist in town that actually does splinting to help with sleep apnea for those that can't handle the CPAP. But it's kind of a big deal when I pick it up. I certainly like to get them onto the appropriate specialist because it can be helped.
Mm-hmm. Yeah, sleep apnea, big issue with health, and if you're obviously not getting enough sleep, you're not getting enough rest, that can cause other issues. So a lot of times, TMJ therapists, all of you guys that I know that work at our company are all very versed in treating the upper neck, upper thoracic spine, cervical spine. Why are you guys looking at those areas when treating somebody who might come in originally just for TMD?
Great question, and it really has a lot to do with posture. We can harp on posture and tell the patient this is appropriate posture, but very often joints are controlled by muscles, and if the joint is stuck in an open position, that tends to change a patient's posture. And we know through research that if the head is quite a bit forward, when you bite down, the teeth touch differently. When you're in a neutral position, they touch differently. And if you're in a back position like this, they touch differently. I think I alluded the last time we talked to the group, I was laying down getting a cap or a crown, and dentist was doing the tap test, and I said, well, my head is back. That's not really the position I eat in. We should do the tap test so that everything is appropriate in a sitting position where this is how I eat. So very important to change that posture. We can change the bite, and that becomes a very big factor in extra stresses that can be created in the muscles and the joints.
Okay.
So great question.
And so I see two scenarios too. Patients might come in and they might be seeing someone for headaches. So you guys might be seeing someone for headaches, and you guys are looking at the jaw, or the other scenario is where they're coming in for TMD or TMJ, and they're having headaches because of it, and you guys are treating their jaw because of it. So what is the connection, I guess, between having headaches and having TMD or TMJ problems?
Well, that's a great question, and I just have a patient actually that I just finished up with, and she had 30 years of headaches, and this is her 5th visit, and she's had 1 headache since our first visit. And that was related more to her neck and trigger points that refer up into the head. So by getting rid of those trigger points, balancing her body out with joint mobilization techniques and appropriate strengthening, we've been able to keep her headache free. You also have muscles that in your face that can control headaches, and in fact, when you grind a little bit, you'll feel that muscle at the top of your head called the temporalis, and when those muscles get tight and develop trigger points, those also can create headaches. So when we have somebody that comes in with either a TMD problem or a headache problem, we screen the whole thing. So Dr. Rakabata, who's one of the foremost experts in treating TMJ, makes a comment, or TMD I should say, makes a comment that you can't treat a jaw without treating the upper back and neck. And I think just the opposite occurs too, is you can't treat a neck without making sure you screen the jaw, especially if you're dealing with headaches. And a lot of these people that we treat that come in where their neck really hurts will often come back if we didn't ask the question about headaches, and they'll say, oh, by the way, I haven't had a headache since we last met. And I might have forgotten to ask that question, and so they're pretty excited about that also.
Well, that's good. So I got through all of the questions that I had, so I guess my message is to anybody that's watching, if you do have questions for Jeff or any of our TMJ therapists, to make sure you either comment on the post or you reach out to one of our clinics and we can get those questions that you have answered for you. But other than that, I hope everyone has a wonderful day. And again, come in and get screened if you think you might have a problem. We hope we can help.
Happy Thanksgiving.